If you've just received an MRI report and felt alarmed by words like bulge, degeneration, or herniation, take a breath. Those findings can sound frightening, but they do not automatically mean you are damaged, disabled, or headed for surgery. MRI images show structure, not the full story of pain. Many people have disc bulges, arthritis, or age-related changes and feel completely fine. In other words, an MRI is one piece of the puzzle, not a verdict. The real question is how your symptoms, exam findings, and daily function fit together. One of the most important things to understand is that many spine findings are common with aging. Disc bulges, for example, are often compared to gray hair or wrinkles because they become more common over time, even in people without pain. A bulge on a scan may simply reflect normal wear and tear. At the same time, there are warning signs that need immediate medical attention. Sudden loss of bowel or bladder control, numbness in the saddle area, or rapidly worsening leg weakness can signal a serious emergency. Those symptoms should never be ignored. Outside of those red flags, most MRI findings are not an emergency and should be interpreted in context. It is also important to know that pain is not always caused by a bone or disc physically crushing a nerve. In many cases, the problem is chemical irritation. A small tear in a disc can leak inflammatory substances that sensitize nearby tissues and nerves, creating pain even when the visible structural change looks minor. That is one reason anti-inflammatory treatment, activity modification, physical therapy, and time can be effective. The body often responds best when treatment focuses on reducing inflammation, improving movement, and restoring strength rather than immediately chasing the scan result. Another key point is that your body has remarkable healing abilities. In some cases, herniated disc material can shrink or be reabsorbed over time as the immune system clears it away. That means pain does not always require surgery, and symptoms often improve with the right conservative care. This is why it is so important to treat the patient, not just the picture. If you are unsure about a diagnosis or a proposed procedure, getting a second opinion can be valuable. A careful evaluation of your symptoms, exam, and imaging can help you make a safer, more informed decision. If you want a deeper look at your spine health and a plan tailored to you, speak with a specialist who considers the whole picture. Call 602-833-2141 to schedule your consultation.